Hi, everyone. Welcome. My name is Marilyn Shannon, and I welcome you today to the Breaking Free Show. And I'm so delighted to have you join us today. And as always, I know that your time is precious. So thank you so much for sharing it with us. And thank you. And happy Thanksgiving, by the way. I hope you all had a wonderful holiday wherever you are, with whomever you spent it with. I hope it was just wonderful. And so today we have another exciting show. I'm going to get into that in a second. But before we get started with our actual show, I want to say hi to Amnan.
Hello, Marilyn.
Hello, Amnan.
How are you?
I'm fine, thanks. And how are you?
I am just
And how
fine.
was your Thanksgiving?
Thanksgiving was thankfully good.
Thankfully good.
Yeah.
Yeah, we went out. I was so happy that none of us, not me, not my son-in-laws, not my daughters, nobody had to cook. It was lovely.
I had to wash dishes. But it's okay. I mean,
Okay. All right. So here we go. On with the show. So let me remind each and every one of you that you can join us in the chat by putting your name in the little line underneath the video, and just you can put your nickname, whatever you like, put it there, and you can join in the chat, and you can ask questions in there and talk to all of our chat members. Or you can call us at 919-518-9773 during the show at any time where you want to make a comment, you have a question, whatever you like. And you also can come in on Skype. You can join us on computers. That's plural. The number 2K voice, and join us in that way as well. And we do welcome you at any point in time during the show to ask questions and to be part of it, because it's important. And we do this because of you, for you, and me too. Because today it's a personal thing. So I have had autoimmune disease, whatever, for since I was 10 months old. I had rheumatoid arthritis as a child, juvenile arthritis, and it has presented itself to me in many different ways throughout my life, but I don't let it control me. But I've been fortunate. And so today I have a very dear friend who's on that's going to be talking about autoimmune, and she is a Oriental medicine practitioner, and I am very happy to have her join us. Bonnie Cashwell, welcome.
Thank you for having me, Marilyn.
It's a pleasure.
Thank you. It's a pleasure to be here.
And I'm really glad to talk about this. And it's interesting because I did a lot of posting about this show, and I've had more comments about this show than we've had in 4 years. So there must be something about discussing this that a lot of people are interested in, concerned about, because I know how it's impacted my life. So, Bonnie, why don't you share a little bit about who you are, and then we'll get on with talking about autoimmune.
Well, I'm an Oriental medicine practitioner, and I am, and this is something that is very interesting to me as well, because it is definitely where we are going with diseases, as diseases transform through the decades, and we get rid of old ones and we develop new ones, and everyone is concerned about this, and so we're just seeing more and more of it. And so in the realm of Oriental medicine, we can offer quite a bit of assistance with getting someone in a more balanced place so that they can manage it better.
And so Oriental medicine acts in what capacity with, I mean, does it go along with regular medicine? Could somebody come to an Oriental medical practitioner like yourself in lieu of going to a regular physician? What do you say?
Well, it depends on what stage of the disease and the
Or
process.
any disease?
Well, if we're staying with autoimmune, that can show up in quite a few ways. I mean, whether it's affecting the nervous system or the thyroid or the gut, and depending on how it presents in each individual person is how it would be approached. But regardless of where they are in the phase, what can happen with the use of Oriental medicine is it can help manage it, it can help reduce the symptoms of it, and it can help slow the progression of the disease.
So, based on what you know and what you see, do you see an increase in autoimmune, or is it just that we're paying more attention to it, or what's in your opinion? Do you notice?
I think it's both.
Okay.
I think that we are paying more attention to it because we're seeing things that we're beginning to realize that the the umbrella of it is broader than we ever realized before, that it is affecting more systems of the body. So from that standpoint, we're getting the clue.
So the autoimmune is the umbrella.
Inflammation might be the umbrella.
Oh, inflammation is the umbrella. And then autoimmune?
Well, they kind of go in tandem, because where you find autoimmunity, you're definitely going to find inflammation. You don't necessarily find autoimmunity where there's inflammation.
Because as I said, I have had rheumatoid arthritis as a child. So when my mother noticed it, initially she was diapering me, and she went to bend my leg, and it wouldn't bend. And so she knew something was wrong. And so she, started that process. And then when I was 7 years old, I think, I was getting out of bed to go get ready for school, and I fell, and I couldn't get up. So those are my memories of early on. I've had several, episodes of things after that, and I have arthritis, iritis in my eyes, and work on keeping that inflammation down. But you're saying it's the inflammation, and then they kind of go together, but it's the inflammation.
Well, it's the chronic inflammation.
It's the chronic inflammation.
Correct. And so what happens when it becomes a chronic state, then different proteins in the body get released, so that these, it's like you hear a lot of buzzwords in the integrative medicine field, like TH3, which is actually suppresses the autoimmune response, then TH17, which is the one that gets it started. And so you have to keep a fine balance between these two. And so an example of how you would suppress your immune system could be exercise that gets the heart elevated, it brings you joy, and so it suppresses the immune system. But then you can overdo that same exercise program, and it will trigger the TH17, which is what starts the flare-up of the immunity.
So using myself as an example, why would a 10-month-old child suffer from autoimmune?
Well, it can be exposure. It can be something that was prenatal. It could be, I can't imagine, well, I guess a child could maybe from an emotional standpoint have, extreme emotions even at a young age if they were under chronic stress. So it's hard to be able to roll back the clock to know the answer to that, but I would guess maybe environmental, quite frankly.
Really? Even at 10 months old?
Well, depends.
It's interesting because my mother was always such a good doctor. She would say to me, when I was at times of my most stress, that my eyes would flare up, and I would have, inflammatory, stages where I would have, my iritis would be flaring up at my most, but I haven't had it in years, so something's good.
Sure.
Like I'm living. So for those people who are listening who really are not so familiar with autoimmune, can you just go into a little bit more like practical detail of defining what it is?
Absolutely. It's really just when the immune system gets dysregulated and it's unable to make the discernment between what is its own tissue and what is that of a pathogenic nature. And so it becomes self-attacking.
So you are attacking your tissue, and it doesn't know which tissue it's attacking, whether it's yours or some infection or something like that.
That's correct. And so when it gets to this place that it is so chronic, it is a self-perpetuating loop.
Okay.
And it doesn't need triggers.
And then, so stress and things of that sort can cause you to do this.
Absolutely.
Attack yourself.
Absolutely.
So is there a spiritual component to this that Oriental medicine deals with?
Well, from the emotional standpoint, which can segue into spiritual or even be inseparable, depending on one's perspective of that. But yes, because you want the body to be in. Um, I mean, if you are in a place where you're always unhappy, that creates an internal environment that is going to create inflammation. So you want the natural opioids produced, and because they also help suppress the autoimmune expression. So that's done through joy and things that calm you and things that make you happy.
Ah, well, doesn't that make sense? But so anyway, let me just remind everybody out there to please feel free to call in again, 919-518-9773. You can call in with your comments. If you have a personal story that you'd like to share, anything, we'd love to have you. You can, partake in the chat as well as contacting us on Skype at computers, that's plural, the number 2K voice. So we talked a little bit about, um, I think that there's an awakening. I think people are becoming more aware of themselves, whether it's pain or otherwise. And I think that that has something to do with why we're noticing these things more, but also there's something going on that
Yes.
is causing, or not maybe causing, but is contributing to this, rise in autoimmune. And what are those things?
Well, we can look at our environment. We're getting bombarded. Our systems are getting bombarded from every direction, from whether it's chemicals, the products that we use, the pollutants floating around in the air. We're also very stressed, and then we can bring in the free radical component as well. These are all huge contributing factors to the environment that is produced in our bodies to contribute to the inflammation.
Got it. And food.
And food, yes.
That's a big deal, isn't it? Food
Huge.
That's huge.
It's enormous.
It's enormous. And explain why you say that.
Well, because several things. Our food does not necessarily have the nutritional value to it of decades gone by for various reasons. And so we're not getting the nutrients that help keep our bodies in sync with the systems, in sync with each other, or in balance. Then we're also being bombarded environmentally, so it ends up with system overload, which our systems aren't getting what it needs to function normally on a day-to-day basis, and then it's being expected to perform above and beyond what it is capable of because it's not getting the assistance of what it needs to be just to function normally. So it runs in a deficit.
And so if we were eating better, or better nutrients, and the environment was better, or whatever, we were not using as many chemicals, so our body wouldn't have to work so hard, and it wouldn't be fighting itself. When you talked earlier about, how our bodies are fighting itself, right?
Yes, well,
Connect that for me.
well, it loses. I mean, because it runs on a deficit. It is running at a deficit, and so it's so busy just trying to stay normal without the the tools that it needs to do that with, and then it's getting bombarded. Then that is it loses its discernment ability.
Ah, gotcha. Oh, that's a big deal, right?
It is.
So it gets really confused.
It does.
It's getting really confused.
And then it just sees everything as a pathogenic organism.
Oh, that's a big deal.
It is.
And that could happen to. So, do I have a predisposition to having autoimmune? Do many of us have that, or is it really in some of us, and we've just made it worse?
I think there is the combination of both. I don't know that there is a predisposition for autoimmunity unless you just are unhealthy
Okay, start off as being
congenitally.
okay.
Correct.
Okay.
But anyone that does not take extra effort to make their lifestyle healthy could put themselves at risk.
Okay. So we have a question, which is a very good question. Now, obviously, you can tell Bonnie knows a lot about these things, but we have a question in the chat that Chris wants to know what Bonnie's path was to being a practitioner of Oriental medicine. So why don't we go back a little bit and add that, and then we'll carry on with the show.
Thank you for the question, Chris. Well, I actually started out in holistic medicine in '96, and I became a polarity therapist and a massage therapist. And an automobile accident really is what led me to acupuncture because I was in chronic pain for quite some years. So, through becoming a massage therapist and getting exposure to all the many different modalities that medicine has to offer, that was how I discovered acupuncture and realized that it could get me out of chronic pain, and it did.
There's your answer. Good one. I have to say, Bonnie's a friend as well, and I've been having some issues with an arm, and she's been giving me advice about that too. And she actually has been giving me better advice than I've heard, more helpful advice that makes better sense than I've heard from anyone really. So it's really interesting because Oriental medicine does encompass a broad range of things, right? Your Oriental medicine container contains what?
It contains body work, and it contains the acupuncture, supplements, lifestyle changes, and Chinese herbs. So I have a lot to work with, and my particular approach is one of functional medicine in that I work with the entire body and the whole person.
Mhm. So that could be with anything.
Yes.
Is there anything that you don't feel comfortable working with?
Probably an infection.
Okay. All right. Cool.
Yeah, there aren't really any conditions that can't be treated with acupuncture and shifted. There's always going to be a benefit that it offers the patient. And if anyone has any curiosity about that, the National Institute of Health publishes on their website an extensive list of the conditions that it recognizes as being treatable by acupuncture.
All right. Great. So let's see. Do we have any other questions here? I don't think so. All right. Um, Getting back to autoimmune. And again, if you have any questions about any specific, I have rheumatoid arthritis, other people have lupus, but if you have any specific questions, please, give us a call because, I would love to address issues that several of you have, questions that you have, as best as we can. So give us a broad thing about all the different types of popular kind of
Diseases.
yeah, yeah.
Well, I think we hear a lot about the gut-related issues, gastrointestinal, which are things like celiacs, Crohn's, ulcerative colitis. Another huge one is Hashimoto's that is so prevalent last night, and that kind of goes back to the whole system overload with our environment and what we can't handle. So most of the Hashimoto's or hypothyroid situations largely are autoimmune
And it's all
related.
I never do that.
Yes, they
Okay.
are.
Okay.
And clinically speaking, I see patients all the time that come in and they're very unhappy with the meds that they get put on because they've not had adequate testing on it. So that is something that is really beneficial to look at if you are in a position where you are unsatisfied with your thyroid meds and you're not getting the results that you want, to look at that from a little different lens and try to get a more complete panel of blood work with the thyroid tests on that. A lupus is another big autoimmune problem. It can affect the brain. Multiple sclerosis is autoimmune related, and of course the central nervous system, which is the brain. I think it's also notable to state that depression is often related to this whole inflammatory process because in this process of chronic inflammation, cytokines get released, and they are messenger cells which actually cross the blood-brain barrier, and it actually does impact the frontal cortex, which causes depression. And unfortunately, antidepressants don't work for depression if they are caused by this. And the reason being is because the underlying inflammation is not being addressed.
So it sounds like even with depression, it's a cycle, like a vicious cycle.
It is.
What came first, the horse or the whatever?
Well, this is how we go back to the self perpetuation of the amplified loop. And while you don't need anything to trigger it, you do need inhibitors to stop it.
And it's hard to diagnose? Are these hard to diagnose?
I think if you are working with someone who approaches or uses actually functional medicine and looks at all of your ranges a little bit more differently, then you're going to be more likely to get it diagnosed quicker.
So I want to talk to you about that because
Sure.
my daughter was diagnosed with celiac
Uh-huh.
several years ago. But prior to that, all through childhood, you know, we took her to a neurologist, took her to a therapist because she had headaches, took her here, took her there, she was this, she was that, she had stomach problems, she had all these things that, again, there was no thread as to connecting them, right? It was, you know, it was nerves, it was emotional, granted, but there was no thread connecting anything until one day she went to a doctor who said, I think you have celiac disease. And as soon as she was diagnosed, it made a big difference, in, of course, you know, in her eating and all of that. So when you talk about the functional medicine aspect, that might have been something that could have been handled earlier.
Yes.
So tell me what your approach would be.
Well, in addition to, using the needles or the supplements would be
Okay,
huge. Go
so
ahead.
let's hold on the needles for a second before we go any further than that. Okay, I know you're all waiting to hear, so hold on. So, okay, we got a question here, and I know you're out there asking the question, but you haven't called in and you haven't written in the chat. Talk about the needles.
Well, the needles are fine. I think that's the concern that most people have, and they're terrified of them, but they're not anything like a hypodermic needle in that they are solid. They're filiform because nothing has to go through them, so that allows them to be much finer. And typically, when you feel them, you just feel that very superficial insertion, because that's where the nerve endings are, is right at the surface of the skin. But then when they go beyond that, you may not feel them. And
I mean, I had acupuncture years ago, and you don't really, you really don't feel anything.
you really don't.
You might feel like no different if you see my hand, no different than just a little touch on your skin.
True.
That, I mean, I could touch all the way, and some of it's going to tickle or whatever, but you really don't feel anything coming in or going out, and it's very kind of peaceful, right?
It is a very peaceful process. It's like taking a trip and not leaving the table.
Ooh, sign me up. Who else wants to be signed up, right?
Yes, absolutely.
So let's get back to then describing the process.
Okay. All right. So the process of Oriental medicine, this is the process you wanted the description for,
and
right?
you included the acupuncture and talking about the needles, and supplements.
Yes. I would look at eating habits. I would look at food groups.
But you do this. Okay, let's back up for a second.
Sure.
So you do this. A person comes in. They don't telling you they have celiac. They
Correct.
don't know what they have.
Right.
But this is part of your regime.
It is.
To go through these steps.
Yes.
And to ask lots and lots of questions.
Yes.
Right?
It is.
Go ahead.
It's because it is through the question asking that I'm able to troubleshoot and see red flags, because most of the time it will be revealed. Sometimes it takes several, question and answering sessions to figure things out, but you do. Paying attention is one of the things that I always get patients to do, because it becomes a teamwork situation. So we talk about lifestyle, we talk about food categories, we talk about what times of day you're taking your meds, and we talk about what supplements. And so there are all sorts of things I do to help people tweak what it is they're doing that's not working for them, so that it can bring them more into a peaceful, harmonious place of living.
And so from that information,
Yeah.
you would then come up with some kind of, do you call it a diagnosis?
Yes.
Okay.
But it would be a Chinese medicine
Diagnosis. And would you come up with celiac disease? Would you come up with some thyroid thing? Would
I
you
could
come up
suspect it, but that if they had not already been to a Western doc to get that technical diagnosis, I may refer them out. And even if they did have a celiac diagnosis, then I would still treat them from the way that Oriental medicine looks at patterns because we have different labels for a celiac disease, although we as practitioners are very familiar with celiac symptoms.
So, and do you, in Oriental medicine, do you identify what you're diagnosing with a specific word like celiac, or do you call it something different?
No, it would be something entirely
Like
different.
what?
Well, again, depending on, because each, we could have 4 different people that have celiac diagnosis from a Western doc, and then I might see it different from a Chinese perspective. So it could be a spleen and kidney dysfunction of some
So
sort.
not every celiac is just plain ordinary celiac.
That is correct, not from our perspective.
So is it usually something different from your perspective? I mean, is it always something different? Is celiac the umbrella, but yet you would see something else and call it that other thing?
Correct.
Fascinating.
Well, that's what allows us to shift things differently when other modalities don't work, is because we do have a very different perspective and a broader one.
It's broader, but it's also narrower.
It is. Well, it gets down to the nuances, is what it does. And it very much tailors it.
So there's not just one rheumatoid arthritis.
Correct.
So what else could rheumatoid arthritis, in your experience and all that you've read, let's say juvenile arthritis, what else is there?
You want the Chinese labels?
I want you, yes, absolutely. I've had the other, now I want yours.
Well, it could be an issue of phlegm. That's one of our huge phlegm. It could be an issue, which has a little different definition than what we think of it in our culture. It could be a qi and blood stagnation, which causes the pain, and so.
And are these curable, or are these still chronic?
That's an open-ended question. There are lots of anti-inflammatories out there in the natural world, and there are herbs that, it depends on how far the degeneration has gone. It depends on whether or not it is reversible. It depends on how much the patient is willing to invest in terms of their effort and how they want to approach it, whether it's from diet or whether it is from supplementation or herbs. So there are a lot of factors. That's not a straightforward, clear-cut answer to that.
I'm finding this so interesting, and I guess, one of the things I always say about even coaching, when I'm coaching a client, is I sit in my coaching chair, whether I'm facing a client or I'm on the phone or Skype, whatever it is, and I sit there ethically because I've had a life. I don't sit there in judgment of anything because I've walked in a lot of shoes. And this particular conversation is extremely personal to me because I've had this my entire life, but sometimes you take things somewhat for granted when they are part of, it's like my left arm, that's how close, this has been to me, so I don't examine it on a regular basis. I just kind of live with it, and I have had all kinds of, issues over it, but talking to you about this now is opening up such an unusual window for myself, one that I've never really went through before. So I find this extremely interesting. So I want to thank you in advance.
Absolutely. Well,
Yeah.
I think that's the beauty of Oriental medicine is it does provide a lot of answers for patients when they have sort of exhausted other avenues.
So if somebody like myself is not in daily I have aches and pains. I don't know if it's arthritic or if it's something else. I have no idea. I assume sometimes when it is. So when somebody isn't facing chronic pain in the moment,
Mm-hmm.
is it something that they should still deal with, Or do you kind of like forget about it till you're in pain?
I think it should be dealt with
Why?
because, well, pain causes stress, and we've already talked about how chronic inflammation can lead to depression. And then it starts affecting your lifestyle and the activities that you can
Mm-hmm.
or want to be involved in.
Mm-hmm.
And any of us that have been in chronic stress, especially that which is more debilitating, we understand that. Even if it is a mild form of depression, it inhibits you.
So here's another question about the herb. So, which I want to. I mean, I can talk a lot about a lot of this. Not I ask questions about a lot because I know very little. But we're being asked. So when it comes to herbs and supplements, do you sell them or do you tell somebody where to go for them?
I sell them.
You sell them.
I am certified.
Okay, so you carry a line of supplements as well.
That or I order them. Some
Okay,
of both.
some of both.
Yes.
Okay. So now how does so okay, so you ask a battery of questions.
Yes.
You find the time of day things are occurring, just patterns and things like that, right?
Yes.
Talk about patterns.
Oh, you want me to talk
Yeah,
about
yeah,
patterns?
yeah. Mention about patterns.
Well,
And
it's about how we conduct our lives, and we don't think about a lot of the things that we do having a pattern and how those patterns create our reality. So it is through my questioning that I figure out what those patterns are. While I can ask you what it is you do, it doesn't tell me what your habits or your patterns are, and that's really where a lot of the answers will lie.
but so when you find out somebody's, let's say myself, when you found out my pattern, how would that lead you to understanding that I have autoimmune something or another?
Well, you could let's just be very simplistic and go back to the exercise thing. You could say I am exercising 5 times a week, which is great, right? Because every time you're getting your heart rate up, and you're getting invigorated, and you feel very satisfied. However, you push it to the limit, and beyond, so that you go beyond that satisfied feeling and that you are exhausted. And so this is a pattern that is not beneficial to you, because that is in fact triggering an autoimmune response due to the inflammation. It's going back to those protein complexes that get triggered as a result of stress on the body.
So what would be the so once so let's say I did work out 5 times a week and I'm really tired. Pat what would you identify in the reaction that would lead you that would be one of the things that would lead you to diagnosing me with autoimmune? What would be something specific that somebody might notice? Is there something specific?
As a result
As a
of,
result of working out 5 days a week, of being tired or wearing themselves out, what would they notice that would say,
I don't know that I can just discern it from that,
okay.
because there's so many, it depends on whether or not it's attacking the brain, the nervous system, and it's affecting the cognitive function, your memory, or whether or not if it's just fatigue, is it affecting your blood sugar? That could be an issue that
So
is
if it, okay,
unrelated to.
I got it. So if it's affecting something,
Yes.
then that something would lead you to an autoimmune possibility.
Well, you would have to look at all of
Okay,
it.
okay,
Okay, because
okay,
like if
makes
someone.
sense.
Okay.
Yes. And if it doesn't make sense to you, then you need to call us.
Yes,
Or
call us.
yeah, or if you have another question, because this is very interesting. I mean, taking, I'm taking something that I have put, you know, just summed up into one lump sum and breaking it down. So if you have a question, 919-518-9773. You can call in from a landline, cell phone, whatever, or Skype with us at Computers 2K Voice, or come in on the chat. There's all kinds of stuff going on in there. Okay, so what else have we not spoken about at this point that as a practitioner you feel is important to bring up about the approach that Oriental medicine takes, or like treating somebody who came in, the supplements you mentioned, but what else would you want to add to this discussion?
I think that if you are in an autoimmune situation, I think it's also a great opportunity to just re examine your life by and large. I mean, once you get the health care down and you've sort of figured out what is going to be the best fit for you, even if you're on pharmaceutical meds, then you might do an adjunct that is in the integrative medicine because that's going to fill in a lot of blanks for you. But then it's also another opportunity to just reassess your life in general and see the things that are working against you, that are causing the biggest stressors, and to eliminate those and fill them with activities and people that bring you joy. That's huge. And that will affect your attitude, which will in turn affect your physicality.
When I was a little girl, they put me on a lot of antibiotics, cortisone, all of those things, and they had terrible adverse effects on me, on my teeth, on so many things that I have dealt with throughout my life. So, when somebody says to me, "Oh, we wanted to put you on antibiotic," I go, "Oh, please, what's my alternative?" Because it plays havoc on your system. So, if, we think that it's healing us and, stopping our body fighting itself, but in turn, it's not stopping that at all. It's just shifting it to something else.
Well, I mean, we have to have antibiotics for some conditions. They're undeniable. But what they do is they wreak havoc on the gut. And so that is what goes unaddressed. And sometimes, and probably more often than not, people don't address their gut flora and trying to replace it once they have been on antibiotics for a while.
Ulcers, many of them.
Yeah.
So I know. So we have a caller. Hello.
Hello?
Hi there.
Hey, it's Patty.
Hey, Pat. Oh, Patty. How are you?
I'm doing well. How are you?
I'm great. I'm great. Nice to hear from you.
Thank you. I have a question. It's actually for a friend of mine. He's got a bad back if he plays golf, and he's got an issue with his shoulder. He's been to a chiropractor 3 or 4 times, and it feels good right after he gets after he goes, but then it comes back, and it might have a shooting pain through it when he moves, or he might just be sitting still and have pain shoot through his shoulder at the joint. So I was wondering what I could recommend to him. Do you think acupuncture, massage therapy, what would be beneficial for him? Because I don't know that continuing to go to the chiropractor hasn't improved the situation.
Well, my question is, does he allow adequate time for healing after he has gone and gotten the adjustment?
Hello?
Did you hear my question?
Patty? I don't know.
Hello?
Yeah, did you hear Bonnie's question back to you? I don't know if she's hearing it.
Hello?
Okay. Can you hear us now? No. I don't know if she can hear, right? She can't.
She says no, she hears.
Oh, she does hear. Okay, so
No,
there she left.
answers.
Okay, so why don't you
Oh, what a second.
is that her back? Patty, is that you? Oh, I don't know if you can hear us.
Patty, can you tell me how
Hello?
long he
Yeah.
is allowing for healing after he has gotten the adjustment? She's not hearing.
She's not hearing us.
Hello? Can you hear me?
Can hear you, but can you hear us? No.
Interesting.
I can hear you through the computer, but not through my phone.
Okay. And that's funny. All right, but did you hear Bonnie's answer to you? Her question back?
Yes, I heard that.
Okay.
I think he's using hot and cold therapy.
But is he
And
allowing?
that sometimes helps, sometimes doesn't.
But is he allowing himself some downtime after he gets the adjustment to allow the tissue to heal before he plays again. Does that make sense?
He does not. Sometimes he does, but he'll go out and play within days.
Okay, so then it's going to just become a situation where he has to manage the pain because he's probably throwing the adjustment back out again. He could try a combination of acupuncture. I mean, I would recommend that he try all of them to see which one he thinks he gets the most relief out of, but he needs to give himself time to heal in between.
That's a very interesting,
Okay. I will pass that along to him.
Okay.
Yeah, Patty, that's a very interesting answer, and it's probably a really good answer for a lot of things that we rush through the process and we don't give our body a chance to work the process or allow the modalities that we're using to help us heal. We rush through them and we don't give our body a chance to rejuvenate.
Correct. And integrate the changes that we've.
Right, because there's messages, and we're
Yes.
not giving our bodies a chance to hear the message.
Right. So it becomes how he wants to experience. This is the pattern thing we were talking about earlier. It depends on what experience he wants. Does he want to always experience chronic pain, or would he like to give it an opportunity to truly heal? And to do that, he would need to continue with whatever therapies that are working, but then refrain from playing for a while.
Okay.
Does that make sense?
Definitely. It does to me. I have to convince him not to continue to go out and play when he'll hurt himself again.
Yeah, I mean, and that's the thing. That's part of, when you have issues, when you know you have certain issues, are you eating the wrong food? Are you going to play? I mean, I have an issue with my arm too. And I'm like not going to do yoga and I'm not swimming because I know that it's bothering me and I want to heal. So, that's a personal thing, I guess, but it's all part of we are partners in the healing of ourselves.
Yes.
Yeah, I looked up online, just pulled up 10 remedies, like holistic remedies for shoulder pain. And I don't remember them all, but one was grape juice with pectin, one was magnesium, one was more exercise. Are there anything like that you would advise that he can do himself other than, not continue to play?
Well, in order for me to really recommend something for him, I would need to treat him as a patient, but there are lots of anti-inflammatories that he can buy over the counter. But to work with a healthcare professional is going to be best because they can give him the proper dosing as well
Mm-hmm.
as how to properly take it. And those aspects are important.
Okay.
Good questions. Good questions, Patty.
Well, thank you.
Yeah.
Thank you. I appreciate your help.
Thanks
You're
for
welcome.
calling.
Thank you for calling in.
Yeah.
All right. Bye.
I enjoy
Yeah.
it. Learning
Yeah,
a
good.
lot.
Thank you. Thanks for being here.
Thanks.
All right. Anybody else want to call in? Please feel free to do that. I have my list of questions, my curiosities, but if I'm not touching upon yours, please feel free to call in because I know that I will learn from that as well. So, so let's regroup just a little bit about Oriental medicine. So it contains an entire field of study, basically, on right? On
Absolutely.
how you gather the information and then how you apply the information for healing. And it
Correct.
could be all kinds of things depending upon the person, their lifestyle, their patterns, all of those things. And then you would so let's talk about for a second we're talking a little bit about how you apply Chinese medicine to autoimmune. And so it could be supplements, it could be lifestyle changes, it could be acupuncture.
Yes.
Now, how does acupuncture help autoimmune?
Well, when what we're doing when we question, it's a little, well, it's pretty much the exact opposite of how we're accustomed to looking at our health. We're accustomed to looking at it as what's wrong. But when I do an intake and have people fill out my medical history questionnaire, which is very extensive in the questioning, I'm looking to learn how your systems within your body work. All of the organ systems, which are organ systems as defined by Oriental medicine, which again have a broader definition than
Can you just give
the
me one
Western.
little example of what that means?
Well,
The
okay,
broader.
so when I say the heart meridian, I'm not talking just about the heart organ itself. I'm talking about all of the areas that that particular meridian travels through in the body. So it would encompass the heart, but if I said there's an imbalance in the heart meridian, it would by no means mean that you had a heart disease. And that sometimes throws patients and scares them, and that's not the situation. But
Okay.
anyway, I'm looking
Okay.
at what the answers are from the questionnaire to find out how your body functions. And that gives me a lot of clues as to where the disharmonies are, where the balances are off. And so I can choose the points that I want to insert the needles based on where the disharmonies are and how the harmonies should be to bring it back into an optimal functioning place.
And is acupuncture one of the primary functions of an Oriental medicine practitioner?
It is.
Okay. And so that is one of the big, it's not, I mean, that's one of the big ways that you would apply Oriental medicine to any disease.
It is, absolutely.
Okay, perfect. But and for some of our purposes, we're particularly today talking about autoimmune.
Correct.
So you would, let's say in acupuncture with autoimmune, where would you put needles in someone that has pain in their body?
Well, it would depend. I
Okay.
mean, and I know I say that a lot, but it would depend because again, not every person that presents with arthritis is going to show up with the same set of symptoms, and they're not. When I look at their history, I'm also not going to see the same pattern. So that's going to determine whether I put. I mean,
Gotcha.
it'll be the meridian, but it's more than likely going to be on the limbs, okay, whether it's the arms or legs. But then there are many meridians to choose from, or numerous meridians to choose from, and many points to choose from.
So, do you foresee when somebody has had autoimmune, whether it's for a week or for years, do you see healing?
Yes, you do see improvement, but the longer any condition stays um, in place without getting addressed properly, the more systems become involved and consequently complex because then you have more to unravel and you have more to treat. So it takes longer in that regard.
Okay, because it's interesting when I've had, for whatever reason, had blood work done, even when my body's feeling great, it still always shows up that I have autoimmune.
Sure.
That I've had always shows up that I have it. So I say I'm a carrier, but I don't know what that means exactly. Okay, so we're talking acupuncture, we're talking supplements, we're talking what else?
Herbs, Chinese herbs,
Chinese herbs.
lifestyle, diet.
What is the thing about gluten-free stuff? Because I am gluten-free because I have a daughter with celiac. I have a daughter that's allergic to wheat. The one that's been allergic to wheat never was officially diagnosed with celiac, but she's been off of wheat for so long they can't really diagnose her with celiac. Well, they can't. Maybe you could still diagnose her with something. And then I'm the carrier, so I just assume I should go off. But what is the deal about gluten?
Well, because of the genetic modification, which is in the protein of the plant, the DNA structure has been altered. And it's that thing that our body doesn't recognize it because now it's different from it was prior to. And it treats it like it is a pathogen or an allergen and attacks it. So then there is the contribution to the inflammatory cycle. And primarily, we are still thinking about the effects of gluten on the gut. And that's just part of the picture because statistically, only about 50%, or maybe a little less, of people that have a sensitivity to gluten have gut problems. It can actually go to the brain and cause brain lesions, which in turn affect your psychology. There's a lot more than it affects than just the gut. It can give people neuropathy because of how widespread gluten is used in our society, and we have to become really savvy consumers to know where the gluten lies
Wow.
in our products.
Wow. So it's a bigger issue than just autoimmune.
It is because I mean now several grains have been genetically modified, and it's again when the body gets it loses its discernment capabilities, then a lot of foods become cross reactive, and because the DNA structure is similar and the body's not able to make the discernment, then a lot of foods become cross reactive. So that makes it broader and more complicated.
Wow. Okay, there's so much to talk about here. It's endless, really,
It
isn't it?
is.
It really is. But my game plan, so to speak, was to cover as much of this surface and to go as deep as we could, in the time that we have with Bonnie. And hopefully one day she'll come back and we'll talk more about some things. So just give us some kind of prescription for health. You mentioned eating healthy. Are you talking organic, natural? What are you talking about?
Organic would be the preference. There are lists out there that tell you the most important foods to make sure that you eat those organically. Not all of, it's not important that all of them are, but there are some that it's very key to do that because organically grown foods have higher nutritional value than those that have been chemically grown. So right there, you want to make sure you have the nutrition that your body needs to function. Giving that's part of the tools.
It's part of the tools.
Yeah. So preventative maintenance is always going to be your best line. The other thing is that don't wait until something gets so full blown before you get it addressed. Do that early on because it will be a shorter healing process and of course less costly. Then if you aren't getting the results from whatever practitioner that you're seeing within a reasonable time frame, then don't stop there. Find the practitioner that works best for you. Because ultimately, to go ahead and handle your health on the front end as well as being preventative is just going to allow you to enjoy your life in a quality way longer. And ultimately, that sounds very practical, but I'm not sure that we always take a practical approach.
And I think sometimes we accept the fact that we're hurting, and it's like a part of life, and I'm getting older, and what the heck? What do you say about that?
Well, I think there's a lot of attitude that goes with that. We can certainly be accepting and have expectations that once we reach a number, then we're going to hit a demise. But that's not true unless you want it to be your truth.
Hmm. And so Oriental medicine is is quite the thing, isn't it?
It is quite the thing.
I mean, it really encompasses so much.
There's so many answers in Oriental medicine, and anyone that has not considered it or given it a chance, I encourage you to. It just is such a fabulous natural way to go, and in the process of you getting a treatment for a specific condition, then other little conditions that were just annoying as opposed to being truly problematic typically fall by the wayside simply because you're making sure that all systems within your body are flowing harmoniously together.
Mhm.
And that sounds pretty altruistic, but that is how it works.
So, who is a good, uh, I'm not saying referral source for you, but who's a good complementary uh, practitioner? Because, like, I have a dear friend who's a homeopath, and she works with understanding, what's going on the inside. So she works from the inside out. Well, who is good for you and why?
A category?
Yeah.
Well, I think naturopaths are good, chiropractors are good, and those would be my first two go-tos.
And why is that?
Well, because they are all naturally based. I mean, you might, depending on how each of those practitioners, how they practice within their own, scope, there might be some overlap, but that's where you're going to get the broadest perspective of all systems if you want to go about a natural healing process.
And as far as legally, how is our legal system looking upon Oriental medicine?
I'm not sure how you mean
Well, in
that.
other words, doctors are okay.
Yes.
What about Oriental medicine practitioners?
Well, I mean, we are okay. Different states recognize acupuncturists differently. In quite a few states across the United States, we are primary care physicians. We have the training for that. This is not a state that allows that.
North Carolina is not a state, but there are many states.
But there are states that do allow that. So I think a lot of times people are not aware of how broad our training is.
So you are considered a primary care physician in other states. So
Yes.
so you could be watching us from Timbuktu, USA, and it's very possible that there is an Oriental medicine practitioner who you can go to, who is considered your primary care physician, and insurance
Correct.
will take it.
Correct.
That's really important. And somewhere in the world, you might be somewhere else in the world, and it is accepted.
And numerous insurance companies do provide benefits for acupuncture. And if you are interested in it, I would encourage you to look at your policy and see if acupuncture is covered.
Wonderful. So now, for those people who are in our area, Raleigh, Durham, Chapel Hill, Cary, North Carolina area, how would they find you?
My website is balancingacupuncture.com.
And people come make an appointment to see you. Your office is in Raleigh, right?
It is in Raleigh, right on the Cary line. And yes, my contact information, email, and telephone number, as well as the services that I provide, are on my website.
So, in closing, what would be some of your closing remarks? In summing up what we've been talking about, what you'd like to get across to our audience?
Well, that autoimmunity is broader than anyone has looked at. If you are working with a doctor who is only looking at your health from a narrow standpoint, ask them to look at it broader, particularly around the thyroid. That's where I see the biggest concern. They're not looking at enough hormones. And even if you have one of the gastrointestinal concerns and they're not looking at it from an autoimmune standpoint, ask your doctor to do that.
So I see this like a cone, like a cone. And like autoimmune is here, but there's so much up here that if you look at all these different symptoms, it can very well be something autoimmune,
Yes.
right? And then you kind of have to turn the cone the other way to kind of get the proper care and healing that you need. Does that make sense?
It does. It absolutely makes sense.
And in all my years, honestly, I have never looked at this in this way. So I really appreciate it.
Good.
Thank you.
Glad we were able to
Yeah.
broaden it for you
Yeah.
some.
Because for me, it's been in my eyes. I as a child, it was in my finger, it was in my legs. But I know people who have it in their hip. So it's coming. It's right. And I've never
Yes.
thought about it that it's stemming from something different. So I appreciate it so much, Bonnie, for you being here.
Thank you.
I'm done. You got
Marilyn.
any questions? Nope. We're good. So thank you all so much for being here today and enjoying the show with us. And I look forward to having you back here next week for another invigorating show as usual. And Bonnie, thanks so much for being here.
Thank you, Marilyn.
I appreciate it.
My
And all
pleasure.
of you, thank you. And all of you out there, mwah, have a great day. Bye.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Health In with Debbie Brooke, Breaking Free with Marilyn Shannon, Lessons of Vietnam with NCVVI members, The Tanya Love Show, Your Healthy Pet with Gisela DiCarlo. And if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by Atomus.com, makers of quality video recorders and converters for professionals, CarolinaApparel.com, and DeltaForce.net.